Hi, guys. Welcome to another episode of Modern Health with Dr. Jane. I, of course, am Dr. Jane. I'm a naturopathic doctor and natural fertility expert. And I am really passionate about helping couples who have been struggling with infertility for over a year to get to the root cause of their infertility struggles so they can conceive naturally. One of the things that I'm really passionate about is education and knowledge, because my couples who have been struggling with infertility, usually for 2, 3, and sometimes 5, 7 years, wish they had this information before they even got started. And another piece is they wish they had that information when they did get started so they could sift through it a little bit quicker and not feel like they've wasted the first couple of years on just figuring out what's wrong. So my podcast is really dedicated to helping you become aware of some of the possible things that could be preventing you from getting pregnant. So if you've already started trying to conceive and you're looking for answers, hopefully there's some things that are going to maybe ring a little bit true for you or really resonate for you to look into it. If you haven't started trying to conceive yet, but you want to make sure that your journey is smooth, then the podcast is really designed to help bring into awareness of some of the things that are going to impact your fertility. Because let's be honest, there's not enough education in terms of what we should do to support like preconception, to do support our bodies, that our health has really declined over the last 10, 20 years, and our fertility rates have really plummeted. 1 in 6 couples right now are struggling to conceive, and that number is predicted to keep going down to as low as 1 in 2 by the year of 2050. And so that's one of the reasons why I'm here, because when I look at my kids and the evolutions that I had to go through to get to my children, and now the experience that I get as a human, as a mother, to be able to grow these children and be part of that, I think is really priceless. And I think that's why women and couples fight so hard to have children. And it's absolutely worth it, but we do not need to put ourselves through hell. And I really talk about making your fertility journey, your healing journey, really coming into understanding why you're not conceiving or what are some of the things that are causing the issues in conception. So then we can get you to the pregnancy. And instead of pregnancy being a process that can become very traumatic and feel out of your control, we want to have an empowering pregnancy where you actually just get to experience what your body is fully capable of. And that big evolution into motherhood, the postpartum, where you actually can now pass on all of the things that you've learned and create that generational health. So that's what I'm really passionate about. And today, you guys, I want to talk to you about inflammation. I know that this is a very broad and vague topic, but I actually get a lot of DMs in my social media where people are like, yeah, I have some inflammation, but other than that, I'm not really sure what could be preventing me from getting pregnant. Or I have maybe some painful periods, or maybe I have a hard time losing weight, or maybe I have some acne. And we use this term inflammation without, I think, really understanding what it means. So today I want to shed some more light on that and help you understand how it's connected to your fertility. Because when people tell me there's inflammation, it's just like way too vague and way too broad that it's not palpable enough in terms of actually tracking it. The mistakes that I see is sometimes people will say, oh yeah, we have inflammation, but the doctor said it's fine. And then we never looked further into it. Or you just kind of try to follow random advice or general advice that you've seen on the internet, like I should have more ginger, or I should have more curcumin, or I should drink more water, or I should do, fill in the blank to help decrease my inflammation, without really understanding what inflammation means, or more importantly, what the root cause of your inflammation. So instead, what we want is we really do want to assess and understand if you have inflammation that is out of control, because we'll talk about the fact that inflammation is not actually bad. It's that when it's too much and the body is not controlling it, that's the bad portion, if you will. We want to get to the root cause of that inflammation. And then, of course, we want to learn how to deal with it. So when you have the root cause of something, then you can when you have the answers, then you can do some sort of treatment for it, as opposed to guessing as to what you think might be going on. So first of all, let's shed some light on inflammation. Inflammation is a natural process, you guys. The easiest way that I can describe it is when you snap an ankle or when you twist an ankle, what happens? It turns red, you have a lot of pain, there's a lot of blood flow that goes to that area, so it swells up. That's inflammation. That's the body's natural response to an injury, to bring a lot of blood flow to the area, because what comes with that blood flow? Well, the white blood cells are in there, so they're going to clean up the debris and infection and anything else. But also there's a lot of nutrients in the blood that are there to bring the nutrients to repair the tissue to whatever the damage has been done. That process literally happens all over the body in obviously a much lower scale than when you break an ankle, when you twist an ankle or have some sort of injury that's physical that you can see. But the process of inflammation is a natural process, and it's actually a response to an damage of some kind, an injury of some kind. And since literally every process in the body has damage that occurs, just the byproduct of building enzymes, breaking down tissue, rebuilding tissue, literally everything and anything, there is a little bit of quote unquote injury that occurs. The problem is when that inflammation goes out of control. So we all have an inflammatory response, and we don't want to suppress the inflammatory response altogether. But what we want to do is understand, why is the inflammatory response there in the first place? Is it out of control? Is it something that we need to worry about? Or is it intact and it's normal and we just need to let the body take its course of action? And what I say a lot in natural medicine, what we talk about is we want to support the body. So if we snap the ankle and it's red and it's swollen and it's painful, we don't want to suppress that inflammation because we need the blood flow to get there. But what we can do is support the inflammation to make sure that it doesn't get out of control. For example, doing hydrotherapy, hot and cold therapy, to help that blood flow move through, right? You can put more nutrients into the blood. So for example, vitamin C and zinc and vitamin A, selenium, collagen, to help bring more nutrients to the blood and repair. And then, of course, you can take even herbs that are going to help support inflammation. Think things like curcumin or boswellia, even ginger. Those are all things that can be anti-inflammatory that will support your natural form of inflammation. And so I use the ankle examples a lot because I think people really can recognize and visualize that, but that process literally happens everywhere in the body. So how do we know we have inflammation? And I want to talk you through the three main ways, if you will, that you're going to know if you have inflammation and if there's something to do about it. So the first way to know if there is any inflammation that is quote unquote out of control in the system that we now need to pay more attention to is any amount of pain in the body. So pain is an indication of inflammation because there's usually swelling, right? And so when there's swelling, you're going to press on sensory, on nerve endings, and that's the body's way of telling you that, hey, there's something going on here. What are the different ways that pain can show up? So for example, like acne, painful acne, right? If you have cystic acne, when you touch it and it's painful, any kind of rashes, so anything that's going to be red, that's going to be hot, any kind of joint pain, obviously, any digestive issues. So if you feel like you're bloated or there's actual pain in the digestive tract, and then any painful periods. So sometimes you're like, I don't have any pain in the body except when I have my menstrual cycle. That tells us that inflammation is out of control. And I have a whole podcast on painful periods where we go deeper into that. So that's one way to know if you have inflammation, if you have pain in the body. The next one is if you feel swollen or if you feel puffy. And now you're not going to have all these three. You might have all these three, but you might just have one out of the three. So the next one is feeling puffy or swollen, and literally like swollen and puffy face, fingers, like you're having a hard time taking your rings off. It could be lines on your stomach after taking off your pants from work, or even bra lines or sock lines or underwear lines, having brain fog, puffy eyes, feeling like you're having a hard time concentrating, and then actually carrying extra weight. And I call it, it's almost like it feels like it's this fluff that's extra on you. And a lot of it is water weight. But then when we're holding on extra water weight, don't get me wrong, there's, I work with a lot of patients with weight loss resistance. There's for sure water weight. And there's also adipose tissue that's just an excess that we need to lose. But when we have excess adipose tissue, aka excess fat, there's inflammation. That's just an inflammatory process. And then carrying the extra water as well, that's a sign of inflammation. The third way to know if you have inflammation is actually just by tracking some data, aka some lab work. So blood work analysis that shows you if you have inflammation is going to be your CRP, so C-reactive protein, ESR, the sedimentation rate. But those are like the most common things that you can test and see if your inflammation is there. But what I actually find is a lot of my people, inflammation can hide in different parts of the body because it depends on where that inflammation is showing up. So you can have elevated liver enzymes. You can have blood sugar dysregulation. So whether that's fasted insulin or fasted blood sugar, that's elevated. Also cholesterol, that's elevated. That's a sign of inflammation in the body accumulating excess cholesterol. Homocysteine levels is usually a sign of inflammation and more specific to the cardiovascular system. If you have really like high white blood cells and there is an infection going on, that's going to be a sign of inflammation. And even like high cortisol or high estrogen, so imbalance in the hormones, those are all signs of inflammation. So don't make the mistake of thinking, wow, I got my inflammatory markers tested and they were all good, but my cholesterol and my liver enzymes, were a little bit out of range. Those are the signs that you have inflammation. And when I go even further into testing functional medical labs like gut stool analysis, environmental toxins, that kind of stuff, I see a lot of inflammation in the gut. So there's actual like calprotectin and MM9, and there's specific enzymes we can test and specific markers we can test that literally tell us if inflammation is in the gut. And I've had people test really well in the blood, and then all the inflammation shows up in the gut. So there's no right or wrong here. It's just trying to really find where your inflammation is. And so if you have any signs or symptoms of inflammation, obviously that's going to be impacted. And so, like I said, for some, it's going to be hormones. For some, it's menstrual cycle. The job is number one, to understand how much inflammation do you have and where is it really coming from? Because then, like I said, inflammation isn't a bad thing, but when it's not controlled and you have other symptoms, then we know the body is not managing. So how is this related to pregnancy? Why does this even matter for fertility? Now, I have a lot of information around fertility and immune system health. So inflammation is a sign that your immune system is upregulated. What happens when your immune system is upregulated? Well, there's a stress on the body now. The body has to fight that stress. It takes a lot of nutrients to deal with that stress, a lot of B vitamins, a lot of vitamin A, D, selenium, zinc, all these nutrients that are really vital for good quality egg and hormone production, good quality sperm for the male partners, now are being put towards inflammation. Not to mention when we're inflammation that's under control, the system is going to be in fight or flight. It's the brain kind of has these priorities in terms of what do you need to deal with. It's going to deal with the thing that is the most important, which in this case is going to be inflammation because your immune system is upregulated. So we want to make sure that our inflammation is very much under control because you're depleting nutrients and your body is going to be under fight or flight. And then chances are when the immune system is dysregulated, now when we're looking at pregnancy, the first reaction of the egg and the sperm is that of the immune system. So not only are you putting yourself at risk because you're probably going to have deficiencies in things like vitamin D, vitamin C, vitamin E, those are important. But now when the sperm comes in and it's a foreign object, if you will, that comes into the female body, the immune system of the female needs to accept that. And if it's dysregulated, it might not accept it. And then if the fertilization happens, that's another foreign object, if you will, in the female body. So the immune system of the female is really, really important in order to be able to downregulate, especially around during ovulation and the second half of the cycle, to allow the fertilization to happen and then to allow the implantation to happen. And I see a lot of issues of uncontrolled inflammation and therefore uncontrolled immune system that then leads to fertility issues. So I think it's something that should not be overlooked. Not to mention, detoxification organs get overwhelmed because again, there's a cause for that inflammation, and whether it's an infection, whether it's an environmental toxin that's building up like mold or heavy metals or radiation, there's so many things that could be causing it. And so what I encourage you to do is, number one, do an assessment on yourself to see, do I have any signs of inflammation? Do I have any pain in the body? Do I have any weight issues or puffiness or brain fog or feeling like, I'm just holding on to excess water essentially? And then what are my blood markers showing? Blood markers is one way to look into it. And then, like I said, I go deeper with my patients and I look at environmental toxins. I look at digestive tract because there's a lot of inflammation that could be coming through there. And then, of course, you can look at infections as well, like Lyme and co-infections, because the higher those are, the more nutrients your immune system is going to need to be able to manage those. And again, it's not that inflammation is bad. It's when it's too much and it's out of control that we get into trouble. So number one is, let's look at, do you have any symptoms? And then number two, let's look at some blood markers. I'm always a big fan of data. We need to look at data so we have tangibles. We know exactly what we're looking for. And then from there, we can start doing some things that help to support inflammation. What are those things? And I'll share my top three. Movement is probably one of those things that's really overlooked, but I'm talking about like stretching, walking, and even doing a little bit of actual movement, whether it's a workout or lifting weights. Yes, it causes inflammation, but then what it does is it helps to decrease that inflammation. And essentially it's because we're moving that blood around, and then you're building muscle mass, and muscle mass is going to be a really good help for our metabolism, help to eat up excess fat, help to balance our blood sugar. So the benefits of having movement to help decrease overall stress on the body long-term and improve metabolic health is really, really important. Your food is obviously going to be really important, making sure that you're eating whole foods and that you are eating organic as much as possible, so you're avoiding toxic overload. And the last thing is going to be hydration. So I know that there's like multiple, you can do curcumin and ginger and include all these anti-inflammatory foods. Honestly, if you punch it into Google, you're going to be able to see a bunch of those. I'm just kind of talking from my fertility aspect of the things that I really get my patients to focus on. So I get them to focus on making sure that they're moving on a regular basis. And sometimes that's through doing movement. And then other times I get them to do saunas and hydrotherapy, so cold therapy, to really help flush that blood in and out through the liver. Essentially, just like when you have a broken ankle and you're putting hot and cold therapy to move that blood around, we want to do that for the entire body. And then, like I said, good quality food, because we don't want to be adding inflammation through food. We want to eat foods that are going to help to decrease that inflammation. And then lots of vegetables, some fruits for sure, good quality meat, curcumin, ginger, spices like fennel, just things that are going to really help to decrease that inflammation and support digestion and support liver function, all that jazz. And the last thing is hydration. And I think that's really overlooked, but we need water for basically every process. Like 60% of body weight is water. And when it comes to fertility, cervical mucus production requires water. Sperm is like 90 to 95% water. So we want to get good quality water, make sure that it's clean. And then we want to make sure that we're adding minerals to that water and we're not adding any more toxins back in. So you're not drinking from plastic containers, you're drinking from stainless steel, or you're drinking from glass, to make sure that we're actually rehydrating ourselves properly, as opposed to just drinking water and it coming right through you. So I hope you guys found this helpful. Just the 3 quick little tips and really getting to the root cause and really understanding, giving you a little bit more information on what inflammation actually is and why it's important to be addressed as opposed to just overlooked. And because, like I said, inflammation is a sign of something going off with the body. And usually it's still very broad. We need to dig deep and understand why that inflammation is there, because it is a natural process. But again, the body is doing it for a reason. So there's something damaging the tissue, and that's why the body is responding with inflammation. So getting to the root cause is going to be super important, and then supporting your body through movement, hydration, sleep, stress management, all that kind of stuff is going to be helpful. Thanks so much for listening, you guys. If you like this episode, please make sure you rate it, click the follow button so you don't miss any episodes. And then if you have any questions, feel free to reach out to me on Instagram at Dr. Jane Levesque. I'm happy to help and support. And that's it for this episode, and I'll see you next time.